I want to once again assure Nigerians that all necessary safety and quality control measures have been put in place for the arrival, storage, and successful administration of the vaccine in the country. There's going to be a small ceremony chaired by the chairman of the PTF on COVID-19 to receive the vaccine at the VIP protocol section, General Aviation Terminal of the Nnamdi Azikiwe International Airport, Abuja. At the end of the ceremonies, to mark the arrival of the vaccines, a few vials of the vaccines will be handed over to the NAFDAC team, which they will analyze over a period of 2 days. Further to the clearance by NAFDAC, the Presidential Task Force, the Federal Ministry of Health, MPHCDA, and strategic leaders will be at the treatment center of the National Hospital on Friday, March 5th, 2021, where the first vaccination site will be set up to commence the vaccination of the frontline health workers and support staff. These staff would also be electronically registered in the COVID-19 vaccine database and will receive their COVID-19 vaccination card, which has a QR code that will be verified anywhere globally. On Saturday, March the 6th, key strategic leaders will receive the first dose of the vaccine. The chairman of the Presidential Task Force will be engaging with Mr. President, the Vice President, and strategic leaders to get an exact date for when their vaccination will be taken publicly. On Monday, March 8, 2021, more vaccination sites will have been set up at designated locations such as the National Assembly Clinic, the State House Clinic, and the Federal Medical Center, JABI, where strategic leaders such as the Secretary to the Government of the Federation and Chairman of the PTF, the Senate President, the Speaker of the House of Representatives, the Attorney General of the Federation, Inspector General of Police, the ministers and ministers of state, senators, House of Representatives, traditional leaders, religious leaders will be vaccinated. After this launch and initial rollout phase, vaccine distribution to the states for the phase 1 vaccination process will begin. This phase is the vaccination of all frontline health workers, their supporting staff, and strategic leaders. Deployment of vaccines to the states will be based on the assessment of their level of preparedness. Some of the parameters that will be used for the assessment include adequate maintenance of their cold chain storage facilities, adequate preparation for logistic transportation to the ward and health facilities, adequate security in place during transportation and at the vaccination sites, completion of training of health workers, efficient social mobilization activities in place, and adherence to protocol for vaccine deployment. Working with CACOVID, plans are on ground for a cargo plane provided by the private sector to transport the vaccines to the states by air. States without a functional airport will have their vaccines transported by road using vans fitted with cold chain cabins from the nearest airport to their states. The vaccines will be stored at the state cold stores from where they'll be transported by road to LGA cold stores. Again, all of these cold stores will have security detail to protect these valuable national assets. Once activities have commenced in the states, there will be strict monitoring by the Presidential Task Force, the Federal Ministry of Health, the NCDC, MPHCDA, independent bodies such as the EFCC, DSS, the ICPC, and civil society organizations, along with other relevant line ministries. The state's health facilities, health workers that are identified as defaulting from the standard protocol and guidelines for this phase 1 of vaccination will be sanctioned. We have all agreed on the prioritization of Nigerians for these vaccines. There is a protocol that has been defined and is being disseminated to make sure that this guideline is followed. While the first phase is ongoing, the Presidential Task Force on COVID-19 and the Ministry of Health will be ready for the arrival of the next batch of vaccines, which will be used for the next phase of vaccination. Phase 2 vaccination processes will involve vaccination of the elderly from 50 years and above. This group has been further categorized into 2, with the vaccination of those that are 60 and above occurring first, followed by those that are 50 to 59 years. This will occur across all the 36 states and the FCT. Those who are eligible for vaccination that have not registered electronically will be assisted at the designated health facility and will also be vaccinated. The phase 3 vaccination process involves the vaccination of those between 18 to 49 years with comorbidities such as hypertension, diabetes, lung disease, other health diseases, liver or renal diseases. Individuals at ages 50 and above with comorbidities would already have been immunized within their age group. The phase 4 vaccination process will involve vaccination of the rest of the eligible populations between the ages of 18 and 49 years. It is worthy to note that at each phase of the vaccination, the level of preparedness of the states will be assessed before vaccines are deployed. There will also be accountability measures put in place to ensure strict compliance to the vaccination process. You would all agree with me that if we're not careful, we would not be able to ensure that the vaccines reach those who critically need them the most. Pregnant women will be evaluated by their health providers to weigh the benefits versus the risk before a decision is taken to vaccinate them or not.